The African Union's health agency says 13 member states have reported cases of the mpox virus. There have been nearly 19,000 suspected or confirmed cases on the continent since the beginning of the year, including more than 1,000 cases in 1 week alone. The figures account for 3 strains of the virus, including the newer clade 1b strain, which is more deadly and more transmissible than the other 2. The hardest hit country is the Democratic Republic of Congo, where the new strain was first detected last September. The country has reported just over 1,000 cases and 24 deaths in 1 week. Let's speak now to Katharina von Schroeder, who works for Save the Children in the Democratic Republic of Congo. That organisation raising the alarm over the impact mpox is having, particularly on children. Katharina, thank you so much for joining us. I wonder if you can start by just giving us the picture at the moment regarding mpox in the DRC. Is this new clade changing the game entirely for a virus that was pretty endemic to this area?
Yes, the new variant of this virus is particularly concerning as it is very active in the east of the Democratic Republic of the Congo, and we have 2 crises or several crises converging in this area. So it's an area heavily affected by conflict, with over 120 armed actors in the area. A lot of displacement, millions of people displaced, and on top the virus, which seems to be very aggressive with children. So that's of particular concern, that it's really affecting a very vulnerable group of the population.
Could you give me an idea of why children seem to be more vulnerable? Is it purely that they are generally a more vulnerable group, so other vulnerable groups, for example, those who are immunocompromised, are equally vulnerable, or are children in particular getting more sick and dying more frequently?
So the medical research is still ongoing. There's no final answer to this, but one of the main theories is that different variants of the virus attack different population groups more aggressively. It seems in this case it's children that are more affected by this particular variant of the mpox virus. So we are very concerned about that, because we're seeing in some specific health centers, we're seeing up to 86% of the suspected cases are children under 18.
How many children have died so far in this latest outbreak this year?
The numbers are still being verified.
All right, we seem to be having a slightly tricky line. Katharina. Sorry, Katharina, just start that sentence again. We lost you briefly.
We had over 500 fatal cases since last December in the DRC, among them hundreds of children. However, we also know that there are cases that are going unreported, so we think the real figure might be much higher than that.
That is really troubling, but thank you very much from Katharina von Schroeder from Save the Children. Of course, there are real concerns about how this disease is impacting children.